All right, so my niece has a colicky baby at home, and so I told her I was going to make her a video, but I figured I would just make one for everybody to kind of help out things you can do at home to kind of help with colicky baby. So this is my little baby here. The first thing I generally will check on a baby is this area here. So real colicky babies tend to have a lot of tension in this low back area. This is, let's pretend this is like the tailbone right here. So this is like that low back area. They tend to have a lot of tension right in there. So just massaging very lightly. You don't have to use a lot of pressure, but you can use a little cream and just kind of rub up and down the spine right here. It feels really good for the baby, but it also helps to relax some of these muscles along the spine here and allow the pressure of the baby's belly being pressed into the table a little bit with a little pressure will help kind of move some gas out. I'll place a pinky here. So if you have your tailbone here, there's another little teeny tiny bone here. And I just kind of come somewhere right in between the two. And, you know, about right here, and I'll just place a pinky in. You know you're in the right spot when the baby kind of pushes down into it because it feels really, really good. And so this is the sacrotuberous ligament that you're pressing on, and that just kind of places pressure on the pelvic floor and some of those areas around the sacrum, and that just helps everything kind of settle, and babies generally will calm down quite a bit with this spot. So yeah, those are two areas I look for. Also, when babies face up, you have their hip bone here and their belly button here. Somewhere in between, right in the center there, you can place pinky pressure. And look, I'm not really putting a lot of pressure. I'm just kind of placing my pinky here. Sometimes you'll feel a little valve underneath your finger spasming. Sometimes with colicky babies, what'll happen are those valves are trying to form, and in the process they'll spasm quite a bit while they're trying to learn how to open and close. So if you just hold some really light pressure there and just allow it to spasm a little bit and kind of calm down, that's kind of what you're looking for there. There's another valve on the other side. You just come belly button, hip bone, right in between, and you can place a little pressure there. So all that's really helpful for those colicky babies. If you've got a really fussy baby that just will not stop and is just constantly crying, they have to be really small, like we're talking newborn to a month old. Fold those hands over like this, hold their head like this, and bounce them around like this. So the fingers here are holding kind of like that face area, and then the rest of your hand are holding their hands just across their chest like this. So the hold is like this, and then you bounce them like this, and you can kind of rotate this part around as you're bouncing to kind of help that stomach just release and calm down. This is a very calming position for the baby. They almost instantly will stop crying if they're real fussy. So you can just kind of bounce them around and do a little figure 8 movement down here, and that'll just help settle that belly and allow that baby to relax a little bit. Always with massage, real light pressure is great. I mean, babies just love to be touched and held and be close to their mothers. So anyway, those are some tips I have for a really fussy colicky baby.